Hello, everyone. My name is Dr. Ella Kadas. I'm the CEO of Nocturne, and I'm very happy to be here and present you how we use AI and retinal image analysis for neurological conditions. Just a bit about our company. We are a spin-off from one of the largest medical universities from Europe, Charité Medical University Berlin. And we have been collaborating and working together with various institutions, but also CROs on the different conditions for which we provide our retinal assessment. Why we started working on this is because we all know neurological conditions like Alzheimer, multiple sclerosis, Parkinson are already a huge burden on our healthcare system. And the number of patients will continue to rise also, and especially due to the increasing aging population. Now, these are diseases that are quite difficult to be diagnosed and usually require complex assessments that are not widely available and complex diagnostic tools. And the other aspect is, on the other side, we know that the earlier we detect these diseases and can provide treatment, then we are actually able to delay disability. So what we want to achieve is we want to provide a possibility and an opportunity to provide screening, diagnosis, and monitoring for these neurological conditions that can be widely available, easily accessible, and super fast, and of course also cost efficient. And how we are doing this, we actually use the retina as a window to the brain. Why? Because the retina is an outgrowth of the brain. So what we know now is that many of the processes that happen inside the brain due to these conditions will be mimicked by the retina. Now, we not only do that, but in order to visualize this, we use an imaging technology called optical coherence tomography, which is now almost in every eye doctor's practice and literally revolutionized the way eye diseases are diagnosed today. And we focus on two particular areas of the retina, the macula and the optic nerve head. Both measurements are volumetric measurements that we get with this device. Super fast, it only takes 2 to 3 minutes to get these images. And we created for neurological conditions, particularly pipeline of assessments. And you can get this via a report. So it's very easy to get the information with our analysis. It's also very important to understand that we look at the retina for neurological conditions in a very different way. So first of all, in the retina that has 10 layers, 3 of them are neuronal layers. And the last one is actually comprised of nerve fibers that project into the optic nerve. And while maybe in eye diseases, generally, the changes that happen can be even visualized with the bare eye. In neurology, we are looking at micrometer changes. So even little changes can be suggestive of so much and can give us so much information. And our clinical applications are, we started with multiple sclerosis and related disorders, where we are supporting the diagnosis, the risk assessment, but also the monitoring. And we are looking into also Alzheimer, Parkinson, mild cognitive impairment, glaucoma, with the end goal to have a screening solution, a screening application for all the changes that are suggestive of neurological conditions. So we have a whole pipeline assessment. Everything is AI-based, starting with analyzing the image quality, then going further and measuring different thickness measurements. But we went even a step further and we realized thickness measurements are not enough because the changes that we see sometimes also create shape changes. And now we can analyze even those changes, the so-called morphometric changes, to be able to get even more insights. And this is a technology that we patented. We validated it on, by now, more than 50,000 optical coherence tomography images. And the use of this application is very fast. You just upload pictures, get a report. And now I'm going to tell you a little bit about the technical challenges that we had and that we've seen with working with different centers, and how using AI we were able to overcome and make ensure that the measurements are much more consistent and reliable and are not susceptible to different images from different devices or different quality aspects that we have seen. And the first thing that we've seen, and now talking about the quality, is that while working also with different centers, we've seen that some of the scans, whether it's because a patient could not focus so well or just because of time constraints, some scans were acquired and not checked for certain quality aspects, that we have the issue that we need to address this. And the community and experts in the field for applying these images for neurological conditions already published also guidelines on how to assess the quality of the images. But of course, this is a very time-consuming process. You need to have the know-how on how and what to discard and when to discard certain scans. So what we did is we created AI-based quality assessment that is taking only 5 seconds, so it's super fast. You just give them the pictures. It includes the current guidelines. It is so it is device agnostic. And what is more important, we were able to reduce the greater discrepancy, especially if we're talking about multi-center settings, and also improve the inter-rater agreement. So what this means is, especially when you have various sites and various grader might grade certain images differently, now we introduced a standard and a consistency into this. And we not only check the image quality, which is in line with the published guidelines, as I mentioned, but we also check if the segmentation, which is super important to get these measurements afterwards, if that is correct and plausible. So we always ensure that you can rely on the measurements that we provide. And of course, if the image quality is not sufficient, you just get this information and you can visualize why, and you can discard the scan. Another thing, as I mentioned, in neurology, we are really looking at micrometer changes, and particularly in the macula, as you can see in the image, we need to ensure that the lines that differentiate the layers are correct. And this is again means, and as it happens for various reasons, the state of the art and even the software that is provided by these devices might not offer this, might create issues in the lines, which meant that somebody, a grader who is trained in knowing where to correct and how to correct these lines, was spending 15 to 30 minutes per eye in correcting these measurements. So again, using quite complex AI pipeline that we developed and validated with data from various centers of various quality, we were able to create a very fast way of getting this information, reduce greater discrepancy, especially in multi-center settings, and even increase the performance. So you will reject less scans because of this quality. And we could show that we are actually as good as the gold standard, which is a manual segmentation, and we can see how well we perform, especially when we looked at what is the noise level and how we can ensure that even if you have certain noise level where you can still detect the layers, you can get really reliable, accurate measurements. And in this example, you can see that we have a patient from that we looked at at one time point and then after a year. And here, just showing you how we have our dashboard, you can see that there is a particular thinning in certain parameters that I'm showing you right now. And this is how you get the report. So you get the quality assessment, and then you get the parameters. And I just marked here the parameters that are outside the normal range or that are affected by a particular condition. Now, what are our clinical applications? As mentioned, we started with multiple sclerosis and related disorders. For these particular applications, we support the personalized treatment, initiation, and adjustment by supporting the initial diagnosis, by supporting the risk assessment, which means that we provide certain parameters that have been shown to predict whether a certain patient having these parameters with a certain range will develop a more aggressive disease course. And then, of course, we also provide various parameters where you can monitor whether there is an inflammation going on or an atrophy. And we are right now collaborating on a large funded European project with various industry partners, university partners, where we want to create a dashboard to have a holistic view of the patient, so to include clinical assessment, OCT, MRI, and then predict, be able to say what is the likely progress of a patient for a particular treatment. So we are able to provide a more personalized treatment course. And just to give you a couple of examples of how we are doing this, so you can assess a ring around the optic nerve head and measure the nerve fibers. And this is particularly interesting because it also shows you that compared to other related disorders and hand controls, you have different patterns of thinning. Looking then at the macula and at a particular layer, you can show that if there is an inter-eye asymmetry in this layer that is 4 micrometers, then it's with 90% accurate on suggesting that there was in one eye an optic neuritis, which again can very much help also in providing the initial diagnosis. This has been published and evaluated with 11 sites around more than 1,300 patients. But if you even looking at the whole macular volume, you can see that there are again different patterns that differentiate between MS and other related disorders that are affected differently or even more aggressively, which provides thinning, as you can see in these pictures in red. And what we've noticed is that thickness measurements are not sufficient to provide you insights of how the shape changes. So we went even one step further and created mathematical models after extracting these layer parameters and analyze now also the so-called shape morphometric changes. And what we could show, for example, in this publication, that compared to MS patients or in related disorder, you have literally in the foveal pit a different shape. It's much more wider, and now we can actually measure it. And thickness measurements were not showing this difference. And the same goes for the optic nerve head, where we, again, apart from various other surface thickness measurements, we went further and look at the shape. So we are able to provide insights on whether there is an inflammation, how this inflammation looks, whether there is an atrophy, where the thinning, what the pattern is. A very interesting application was for detecting in glaucoma patients at risk of visual disability. And again, with our shape changes, we could see that there are certain phenotypes very early, and they can show early diffuse patterns. And this is predictive in a way for visual disability that might develop. And a very interesting aspect was that, as I mentioned, sometimes you don't have the necessary quality to go and analyze the layers, but with this shape, where we look at the whole shape of the macula, we still are able to use those scans that might have been acquired super fast in a clinical setting and might not have the quality to look inside the layers. And I'm super excited and looking forward to look into mild cognitive impairment and Alzheimer's disease, because we know by now that retina changes 10 to 20 years before. But studies were so far inconclusive exactly how these changes happen. And we know with our technology, we are confident that we can really get much more insights into this disease and detect things for even patients that are only mild cognitive, or maybe patients at risk. And we know identifying these patients would be super important also from the aspect of new treatment development. And one study that I'm super excited about to see the results, this has been a 5-year-long study, is called the Atlas of Retinal Imaging of Alzheimer, where 330 people were enrolled, women, men, like healthy controls, adults at risk of developing Alzheimer and Alzheimer patients. And the idea is to have a very good cohort defined with these retinal imaging assessments to be able to see how these changes occur and when, and how we can measure this. And it's very exciting because even the preliminary results showed very interesting insights on various patterns of thinning that occur that can differentiate between healthy and patients at risk. So with that, I thank you so much for your attention, and I'm open to all of your questions. I hope I can reply everything, and I'm also happy for any questions that you might have even after the session. Feel free to just contact